contributor Dr. Lisa Larkin is hosting a breast cancer risk assessment event this weekend.
We're learning how it can change the breast cancer conversation. Plus, a new study is out about survival rates for women during heart attacks when they have a female physician. And Dr. Larkin joins us now with some insight. And let's start with that. Tell us a little bit about this study that recently came out.
Well, first, thank you for having me back. So this is very important. So although I'm doing a breast cancer prevention event tomorrow, heart disease is actually very important and the leading cause of death of women. What we've known for a long time, though, is that the survival with women with a heart attack is actually lower than with men. And we have looked at a lot of reasons for that. One of them is, several of them, is that women present differently with their heart attacks, and women are less aware of what heart attack symptoms are. But the study that was published this week is fascinating. I think we have another reason why women don't do as well with cardiovascular disease. So this was a very large study looking at claims in Florida over almost 20 years. And they looked at the survival of women from their heart attack when they presented to the emergency room. And there was an incredible correlation between the gender of the physician taking care of the patient.
They were more likely to live if they had a woman doctor. Why is that?
So I think there's some potential flaws with the data, but the data really not only showed that the highest survival was with women cared for by females, the lowest survival of women was women cared for by men, but if women were cared for by a male, but there was a high percentage of females on the faculty of that treating institution, women did better as well.
Interesting.
And so there's been some theoretical discussion now about why that might be. Women, we know in past trials that women caring for Medicare recipients, patients tend to do better. And we don't know if this has something to do with the way that female physicians interact with patients compared to males. But again, it's not a men against women discussion.
Right.
But I think in this era of really looking at the impact of gender on diseases, we also can take a look at the gender, how care is impacted by the gender of the treating physicians, and really across the board look at ways that we can increase diversity in our physicians and improve care.
Okay, really interesting stuff there, and we'll probably find out more as the study kind of continues to go on. But let's also talk about your seminar that you have coming up tomorrow. A lot of interesting things have been coming up about breast cancer research. We know we need to get our mammograms and that type of thing, but what else will you be covering tomorrow?
So mammograms, first of all, are important, and everyone should be getting their annual mammogram. But mammograms, unfortunately, only screen for the presence of cancer. And what's really important for women is to, much like they know their cholesterol or their blood pressure, I'm really passionate about now trying to educate women about what their individual risk of breast cancer is.
So how do you find that out?
Right. So women typically know the statistic 1 in 8 or 12% risk of developing breast cancer over their lifetime. But when you ask a woman, how does your risk of breast cancer compare to that number, they look at you like a deer in headlights.
Right.
Women really kind of have this sense still, unfortunately, that they're just waiting to get breast cancer, and the mammograms are really all that they can do. We know that about 30% of breast cancer is related to lifestyle factors. Women largely are not aware of that. And now there are really readily available risk assessment tools that require biometric information, reproductive factors, as well as an extended family history, and breast density, which is really important, which can be taken into a risk assessment algorithm to help women understand if their risk is higher than that 12% lifetime risk or lower than that 12% lifetime risk. And in the 5 prior events that I've done looking at women, the data is actually pretty compelling that's come out. Allie and I are just submitting this work for publication. But the number of women who really misidentify their risk of breast cancer is huge, and the percent of women that we've identified in these events who are really at substantially elevated risk and who don't know it, where we have the opportunity to kind of educate them about ways that they can lower their risk, including potentially the need for genetic consultation or expanded screening or lifestyle steps that they can take to lower their risk.
And they're telling us we're out of time, but just real quickly, I want to just ask Allie, you're going to be asking women to take part in your research project when they come tomorrow, right?
Correct.
Why is that important for them to do that?
So the goal of this research is to kind of identify the impact that this education has on these women, is that encouraging them to take these steps to make lifestyle decisions to reduce their risk, or to pursue genetic consultation if appropriate for them.
Okay, very good.
Yeah, and so we have more information about Dr. Larkin's free educational event.
Women are welcome to come tomorrow, even if they have not registered. It's free and open to the public.
Just free and open to the public.
10 to 12 tomorrow.
On local12.com, you can find it under the Get It button.
Yeah, it's at the barn in Mariemont. And now we'll go over to Tara.